Hey everyone, and welcome back for another deep dive. Today we are tackling cancer and looking at prevention, treatment, and all the resources out there to help you stay informed and empowered.
We're taking a look at a source, kind of like a podcast episode.
Yeah, it's titled Decoding Cancer, Prevention, Treatment, and Hope. So let's just jump right in.
Okay, great. So this source really gets into the importance of early detection.
Yeah, for sure.
Like the impact of early detection on the success of treatment is incredible.
It really makes you think about being proactive with your health, Okay, so what are some of the screening recommendations they highlight?
Well, they talk a lot about mammograms for breast cancer.
Makes sense.
They recommend starting them at age 40 or 50, depending on your risk factors.
Right.
Things like family history and all that. You really need to talk to your doctor to figure out what's best for you based on your situation.
Okay, so mammograms, what else?
They also emphasize colonoscopies.
Yep, starting at age 45.
Exactly, for colorectal cancer.
And for lung cancer.
Yeah, they recommend low-dose CT scans for current or former smokers.
So those are like the big three they focus on. Now, I'm curious, why are these screenings so important? Like, what's happening during them that makes them so impactful?
It's all about catching cancer early.
Okay.
When it's most treatable.
Base stuff.
Like with a colonoscopy, doctors can actually remove precancerous polyps during the procedure.
Oh, wow.
So it prevents them from developing into cancer.
So it's not just about treating cancer that's already there.
Yeah, sometimes it's about preventing it altogether.
That is amazing. Like stopping it before it even starts. Wow.
It's pretty powerful.
This source also talks about something called liquid biopsies. Have you heard of these?
Oh yeah, it's pretty cutting edge stuff.
So what are they?
Imagine a blood test that can detect cancer DNA.
Whoa.
Years before any symptoms even show up.
Wow.
Yeah, that's a liquid biopsy.
So how does it work?
It basically analyzes these tiny fragments of DNA that cancer cells shed into the bloodstream.
That's wild.
So it can pick up on cancer super early.
Years before a tumor would even be detectable.
Exactly.
That is mind-blowing.
It has the potential to totally change how we detect cancer.
I can see that. So we talk about early detection.
Right.
But what about when treatment is necessary? The source dives into some really interesting advancements there, too.
Oh, yeah.
Can you tell us a bit about those?
Absolutely. One of the most exciting developments is immunotherapy.
Okay, I've heard of that, but break it down for me.
Okay, so instead of directly attacking cancer cells like chemo, immunotherapy uses your own immune system to fight the cancer.
So it boosts your body's natural defenses.
Exactly. It makes them more effective at targeting and destroying those cancer cells.
Okay, so there are different types of immunotherapy, right?
Yeah, like checkpoint inhibitors and CRT cell therapy.
Checkpoint inhibitors.
It's kind of like they release the brakes on your immune system,
Interesting.
allowing it to recognize and attack the cancer cells better.
Makes sense.
And then CRT is really cool.
So
They actually take your own T cells.
those are the white blood cells, right?
Yep. And they modify them in a lab to specifically target the cancer cells.
Whoa.
And then they infuse them back into you.
So it's like building a personalized army against the cancer.
Exactly.
That's amazing. So immunotherapy is all about boosting your own body's defenses.
Right.
What about targeted therapy?
Oh, yeah. That's another really precise approach.
Tell me about it.
It goes after specific genetic mutations within cancer cells.
So it's kind of like a personalized attack.
Yeah, it's like a laser-guided missile, minimizing damage to healthy cells.
Wow.
The source talks about PRP inhibitors as an example,
Okay.
which are designed for people with BRCA gene mutations.
Which are often linked to breast and ovarian cancers.
That's right.
So knowing the genetic makeup of the tumor helps doctors choose a more effective treatment.
Right, and one with fewer side effects.
This is like creating a custom treatment plan.
That's basically what precision medicine is all about.
That's pretty incredible.
Yeah.
But these treatments are still being researched, right?
Yeah, a lot of them are still in clinical trials.
What would you say to someone facing a cancer diagnosis who might be considering a clinical trial?
I'd say talk to your doctor.
Yeah,
They can help you weigh the potential benefits and risks.
because it's a big decision.
Yeah, it really is. And it's important to remember that clinical trials are crucial for advancing cancer research.
True, they're helping us develop better treatments for the future.
Absolutely.
Okay, so we've covered early detection and some of the latest treatments. Now let's talk prevention.
Okay.
What does this source say about the role of prevention in the fight against cancer?
Prevention is key.
Okay.
And the great news is that the source says up to 40% of cancers are linked to preventable factors.
40%.
Yeah,
That's a big chunk.
it is. So that means we have a lot of control over our risk.
That's empowering to know.
It is.
So what are some of these preventable factors we can actually do something about?
Well, the big one is smoking.
Yeah, we all know that's bad.
It's the leading cause of lung cancer.
And it's linked to so many other cancers too.
Yeah, like a dozen other types.
So quitting seems like a no-brainer when it comes to cancer prevention.
It's one of the best things you can do for your health, period.
Okay, so smoking's out. What about diet and exercise?
That's another big one.
I know, but what specifics does the source recommend?
They say to really focus on fruits, vegetables, and whole grains.
That's pretty standard healthy eating advice, right?
Yeah, but they're packed with antioxidants, vitamins, and fiber, which can protect your cells from damage.
So ditch those processed foods, the sugary drinks, all that good stuff.
Exactly. Focus on whole, unprocessed foods as much as possible.
Got it. And how about exercise? What role does it play?
Regular physical activity can lower the risk of several cancers.
Like which ones?
Breast cancer, colon cancer, just to name a few.
Okay,
It helps you maintain a healthy weight, it boosts your immune system,
makes sense.
and it reduces inflammation.
So basically, moving your body in whatever way feels good is a good way to prevent cancer.
Exactly.
Okay, what else?
It also mentions sun protection.
Yeah, skin cancer is so common,
It is.
but it's also very preventable.
Right, so they emphasize using sunscreen with an SPF of 30 or higher
Okay.
and reapplying it every 2 hours.
Especially when you're outside.
Yep, and don't forget about hats and sunglasses.
True, those can help too.
Yeah, they offer an extra layer of protection.
And they can be super stylish.
Exactly.
Okay, so sunscreen, check. And then the source also mentions vaccinations.
Specifically the HPV vaccine and the hepatitis B vaccine.
Can you tell me why those are important?
Sure, so the HPV vaccine can prevent several types of cancer, including cervical and throat cancer.
Wow.
It protects you from the human papillomavirus, which is a common sexually transmitted infection.
Okay.
And then the hepatitis B vaccine can reduce your risk of liver cancer.
So they both protect you from viruses that can lead to cancer.
Exactly.
Wow, it's amazing how vaccines can essentially train your immune system to fight these off.
It is pretty amazing.
It's like giving your body a heads up.
Exactly, like a set of instructions on what to look out for.
So even with all this amazing progress in prevention and treatment,
Right.
a cancer diagnosis can still be a really tough thing to face.
Oh, absolutely.
What does the source say about support for those facing a cancer diagnosis?
Well, they emphasize that you don't have to go through it alone.
Okay, that's
There's a whole network of support out there.
I'm glad they addressed that.
Yeah.
What specific resources did they mention?
They talk a lot about the value of support groups,
Okay.
both in person and online.
Support groups can be so helpful.
Yeah, they give you a chance to connect with people who really understand what you're going through.
Yeah, for sure. What else do they suggest?
They also mention organizations like the American Cancer Society and Cancer Care.
Oh, right. Those are great resources.
They offer tons of support.
Like what?
Everything from counseling to financial assistance, information about treatment options,
Okay.
and even help with finding clinical trials.
So really wide range of resources.
Exactly, whatever you need.
That's reassuring to know.
Yeah, there's a lot of help out there.
And it's not just for those facing cancer, but for their loved ones too, right?
And of course, caregivers play such an important role.
They really do. And speaking of caregivers, I think it's important for them to remember to take care of themselves too.
Yeah, self-care is so important for caregivers.
It's easy to forget about that when you're focused on taking care of someone else.
Right, but caregiving can be so demanding, both physically and emotionally.
It can really take a toll.
So you have to make sure you're taking care of yourself too.
It's not selfish at all.
It's essential.
You need to be able to keep giving that support.
Exactly, and to avoid burnout.
Right. It's about being the best support system you can be.
That's what it's all about.
And that includes taking care of yourself.
Absolutely.
Like they say, you can't pour from an empty cup.
Exactly. You have to fill yourself up first.
Okay, so self-care for caregivers. Check. Now, this source ends on a very hopeful note.
It does.
What are some of their main points about the future of cancer research and treatment?
Well, they highlight all the incredible progress that's being made.
Yeah, there have been some amazing breakthroughs.
There have. And survival rates for many cancers are higher than ever.
That's really encouraging to hear.
It is. And new therapies are being developed all the time.
It sounds like we're really moving in the right direction.
We are.
It's amazing to see what researchers and healthcare professionals are accomplishing.
It really is. It's a testament to their dedication and hard work.
Yeah, and to the resilience of the human spirit.
Absolutely. People are so strong.
It's really inspiring.
It is very inspiring. And it's really inspiring to see how much knowledge and awareness can impact our health, you know?
Yeah, like it's giving us the tools we need to take charge, right?
Exactly. The more we know about prevention,
Yeah,
about the different screening options and the latest treatments, the more empowered we are.
exactly, to make good decisions for our health.
And to advocate for ourselves.
Yeah, like asking the right questions.
Right, and knowing what's out there.
Absolutely. And I love how this source really emphasizes hope.
Yeah. It's not all doom and gloom.
Not at all.
There are real reasons to be optimistic when it comes to cancer research and treatment.
For sure. We're seeing these incredible breakthroughs.
They are new therapies all the time.
And survival rates keep going up.
It's pretty amazing. It really shows the dedication of all these researchers and doctors and nurses.
Yeah, and the patients too.
Oh, absolutely.
Everyone working together to make a difference.
It's a global effort.
It really is, all pushing towards a future where cancer isn't such a scary thing.
Yeah, a future where it's more treatable, more manageable.
And maybe even preventable in more cases.
That's the dream.
That's what we're all working towards.
Exactly.
Well, we've covered a ton of ground today.
We have.
All thanks to this one source. It's really packed with information.
It is very comprehensive.
So as we wrap up, what are some of the key takeaways you hope our listeners will remember?
Well, first and foremost, the importance of early detection.
That's been a recurring theme for sure.
It really is crucial. Those screenings can be lifesavers.
They really can. So everyone, schedule those screenings.
Yeah, and talk to your doctor.
About your family history and your individual risk factors.
Exactly. Knowledge is power.
Absolutely. And what about prevention?
Oh, right. Big one there.
Big one.
Embrace those healthy lifestyle choices.
Okay, let's break that down a bit.
All right, so quitting smoking is huge.
No smoking. Got it.
What else?
Remember those cancer-fighting superheroes we talked about?
The fruits, veggies, and whole grains.
Yep, load up on those.
Makes sense. And don't forget to move your body.
Exercise is key.
It all adds up.
It really does. And what about those who are already facing a cancer diagnosis?
Yeah. What advice would you offer them?
Well, I'd say explore all of your options.
Okay.
Talk to your doctor, about all the latest treatments like the immunotherapy and targeted therapy we were talking about.
It's
About being informed
absolutely understanding what's out there.
and knowing that you're not alone in this,
Right. There's so much support available.
like those support groups.
Both online and in person.
And those organizations like the American Cancer Society,
And cancer care.
they can help guide you through everything.
They're fantastic resources.
So remember, you've got this. And there are people to help you every step of the way.
That's a great message.
It's really inspiring to see how people come together,
Yeah.
when facing something like cancer.
It's a tough journey, but there's a lot of love and support out there.
So it seems like knowledge, action, and community are really the pillars of this fight, wouldn't you say?
That's a great way to put it.
We can all play a role, no matter how big or small.
Exactly. Every step counts.
Whether it's scheduling a screening, making a healthy choice, or simply offering support to someone who needs it.
That's what makes a difference.
That's what brings us closer to a brighter future, a future where cancer is less of a threat.
It's a future worth fighting for.
Absolutely. And that's a powerful message of hope to carry with us.
It is very powerful.
Wow. We've really explored a lot today, haven't we?
We have. It's amazing how much information is packed into that one source.
I know, it's incredible. And it really leaves you feeling empowered,
Yeah.
like you can actually do something.
I agree. It's not just about feeling helpless.
Not at all. It's about taking action.
Right. Knowledge is power.
Exactly. So before we wrap up,
Okay.
is there one final thought you want to leave with our listeners?
I think the biggest takeaway is that you really do have more control over your health than you might think.
Yeah.
Whether it's scheduling that screening or making a healthy choice at the grocery store, every step matters.
It really does. So everyone listening, remember that. You've got this.
You do, and you're not alone.
There's a whole community out there to support you. Well, this has been another deep dive into the fascinating world of knowledge and discovery.
It has.
Stay curious, everyone. Stay informed and take good care.